I started my journey with many other professors, and we wrote this particular first 1,000 days. I'm sure you heard about first 1,000 days, but what's this 1,000 day about? Really is about, in bottom line, the microbiome. So I wrote one of these papers about why we should really think about the microbiome and why it makes a big difference in the journey of trying to decrease allergy in the world. Me and many professors around Australia wrote this, and it's been published. About 500,000 pamphlets of this been distributed to most mothers and babies around Australia. And certainly we were trying to understand and let people understand that the microbiome is part of the first 100 days, let alone introduction of solids early, and also influencing, trying to decrease sensitization to all the different allergens we have. So basically, my journey started quite a long time ago. This is a few of my publications, and you can see this is a citation index, and that tells us really, right, about what people are interested in reading and citing, of course. My citation index is obviously there, which gives you about 5,000 articles already cited our papers. And so really the top one is, interestingly, is a global survey on changing pattern of food allergy burden. And that means that allergy is really top of the list of things. So with nearly 700 articles, other publications have been citing our papers on early introduction of solids, the winner opportunity, and using the microbiome to change it is certainly very, very important. So really what we want to do now is to look at some of the things that we're going to talk about, the HMO. Now, human milk, you probably heard about this already, but human milk oligosaccharide means that one of the benefits of breast milk is actually HMO. And so, but there are a lot of babies who cannot have breast milk and therefore doesn't have HMO. And that's the question. The question is about, have we got enough HMO to change the microbiome around? Okay. Mind you, not all breast milk has similar amount of HMO. Some breast milk have less. And so I'm going to be talking about that as well. So in other words, just because you have breast milk doesn't mean the fact that you're going to have a prevention of allergies. The risk of allergy is about the microbiome. And of course, formula-fed infants have an increased allergies and sensitization to allergies. And so it's actually quite important to think about the fact that how we modify it. Breast milk is the beginning phase, but of course, can we add to it so that we have less patients having allergies itself? We know that by being some of the HMOs can bind the allergen itself, and when you're in the right time to introduce solids and allergens, then having the HMO may well help that. So that's just a brief about HMO, but certainly I'm going to go through the whole idea, the whole concept. So why do people develop allergies? That's the biggest question. So look, my husband, my father, no, there's no allergies in my family. Why are we getting it? And often say, well, we live in a too clean society, so-called a hygiene hypothesis, all right? And that hygiene hypothesis is probably real. If your child was born in the third countries, the chance of allergy is much lower, right? And now, of course, if you Google, which has the highest allergy rate in the world, Australia is certainly the highest, the allergy capital of the world, followed by UK. And are we more clean? Perhaps we are, right? And so that's the big concern. And having allergy is a big problem. So these poor patients, right, having a diagnosed allergy means that, well, can they go out for having dinner? Can they go out and party? It's not easy, right? So they often have to bring their own food. They fly a plane. They have to bring their own, everything. That's make sure they cook it themselves. So really it's a big life concept that they need to struggle with. And we don't consider that. To me, it's a bit like having cancer in some ways because it's such a burden on them that we don't realize. Unfortunately, nearly 10% of patients have it. Now, this is my daughter and the dog, and there's many studies now showing that if we live in a zoo, in other words, the more animals there are, the chance of decreasing allergy may well decrease by 90%. And so a big Melbourne study showed that, analyzing those who had dogs with 5,000 patient cohort, found that certainly those who had dog that lives inside compared to outside, their chance of having developing allergy is lower. Of course, that's my little cute dog. And so the other thing, of course, is what I've been trying to work on. How do we modify it? So how do we change the microbiome by using literature, letting people know, and talks like this to talk about allergy. And this is some of my publications that I've done before about prebiotic and working on the microbiome story, okay? So one of the things about probiotics is what I've been working on for a long time, is this Cochrane view about decreasing, I guess, eczema, which is very common. And really, one of the things about this is that eczema is a very, very important part of developing allergies. So really, if a patient comes to me, it doesn't have eczema, well, I don't think their chance of having allergies, in fact, is much, much lower. It's because there's eczema, right? Having eczema, there's broken skin. That broken skin is basically a way of allergens, if they haven't eaten it before, becomes a problem. Say a mother loves eggs, they fry eggs all the time. The fumes of the egg can penetrate through the skin, and that child's not even eaten egg before. They can be sensitized to egg. In fact, majority of my egg allergy patients are actually that. They have eczema first, and then after that, they become sensitized to it. And so how can we prevent this? Is really about the microbiome. Having probiotics and potentially prebiotics as well may well decrease the chances of having the eczema. And this Cochrane view that I did shows that significant benefit of using probiotics to, number one, prevent eczema and therefore prevent allergy long term. And I said before, the prebiotic effect, which HMOs are, promotes a microbiodiversity, which means that we want not just the bad bugs, we want a range of good bugs, right? Like bifidobacterium, which basically HMO helps to facilitate to grow. And that diversity will decrease allergy risk. So this is my other Cochrane review on prebiotics. So prebiotic is a HMO. And when we published this, there was, again, significant benefits of having prebiotic to help the probiotics to grow. So I consider prebiotics, like HMO, is the field, the branch, the tree that helps the probiotic to facilitate and grow. And so that's part of the whole picture. So you have to understand not just giving probiotics, but the background of making probiotics grow themselves is the prebiotics. Which bugs are we talking about? We probably heard when you look at any yogurt container, lactobacillus. So what does lactobacillus do? Firstly, a lot of people, especially Asians, have a lactose intolerant. The reason why they call it lactobacillus, because lactobacillus breaks down lactose, which is obviously helps. So yogurt have lactobacillus acidophilus, a lot of it there. And what we found is that lactose rhamnosus is one that been associated with decreasing allergies because it helps the skin decrease eczema, and that's the benefit of the lactobacillus strain. The other one is really called bifidobacterium. If you're breastfed, bifidobacterium grows a lot more, especially bifidobacterium brevi, which is what we've been giving, like M16V, which is a type of bacteria, bifidum brevi itself. And so what happens is that you have to remember bifidobacterium means bifid, a bit like a kangaroo ear, like that. And that's why it's called bifid, because when you look at it in the microscope, it's a bifid organism. And so this bifidobacterium is really promoted by basically having breast milk. And of course, we know very well that bifidobacterium is decreased with certain things like cesarean section and antibiotics. So we obviously looked at, with all this research on probiotics, which bugs is the best? not just all bugs works for everything. So they've honed into studies saying, okay, let's look at all the randomized studies on different problems, like allergy prevention. We use rhamnosus or LGG, the same thing. Okay, there are certain strains that are better than others. And then they've studied reuteri, which has been used for colic. And some studies, randomized studies, showing that reuteri is useful. And then they've studied in terms of fermenters and salivarius versus antibiotics may well decrease mastitis rates. So again, a different species for a different purpose. For obesity, paracasia may be useful. And of course, bifidobacterium brevi, M16V, has been useful because it liked having breast milk. And again, is associated with decreasing allergy sensitization. And so if you got diarrhea, of course, I always have to let people remember that SB should be part of it, or Saccharomyces boulardii. And having SB helps gastro and diarrhea, as well as Lactobacillus acidophilus and Bifidobacterium bifidum. And so often, if you have antibiotics, often you get diarrhea and tummy aches. And having a very broad spectrum probiotics will decrease that. A lot of people ask me, oh, isn't having antibiotics totally opposite to probiotics and therefore they might not work each other? In fact, having probiotics is actually helpful to decrease side effects when you are antibiotics. But of course, don't eat it at the same time. Do it separately because some of the antibiotics might well kill the probiotics, so that doesn't work. And so I touched a bit about cesarean sections. Well, we know very well in most private hospitals, cesarean section rates is in the order around about 40 to 50%, which is pretty high. And so again, there is statistically significant increase in allergies. Of course, not everybody, because every time a mother asks me, oh, my baby's got allergies, and I don't. First question I ask you, what questions I ask parents is that, was the baby born by cesarean section? Was antibiotics given during delivery, right? And also, was your vitamin D level normal? Because low vitamin D, having cesarean section, and antibiotics, especially to the baby as well as the mother, will increase allergy rate. That's because the microbiome is affected. So changes in the cesarean section is actually bifidobacterium has dropped. A significant decline. And so, but the fact that bifidobacterium is one of the things that's associated with cesarean section being lower, it means that if we can have something like HMO to help bifidobacterium grow, that may well change the course of the child developing allergies. Now, placentas when they're born are not sterile. There are many bugs in already, including E. coli, Bacteroides, very similar to the oral microbiome. Vagina microbiome is mostly lactobacillus. And so if you're born via vaginal delivery, you will get a lot more lactobacillus in the baby. And of course, bifidobacterium and Bacteroides. If yours had a cesarean section, they've swapped them and found that, well, certainly bifidobacterium is lower and lactobacillus is lower, but they have much more Staph aureus, which is a bad bug, and a lot more Clostridium is also another bad bug. So antibiotics is part of my history. Why did your child have allergies? Did you have antibiotics? We can't blame them. They can't say that, not to have antibiotics during delivery, but that may be a cause. And that's why we have to think about when the baby is born, had antibiotics, has a cesarean section, can we modify it? So we know that antibiotics for group B strep, and 30% of mothers will have group B strep as a carriage rate, will have a significant decrease in bifidobacterium by day 7 of life. And so really, how do we think about of changing that? We know antibiotics already, we know that it increases allergies per se, even giving the baby antibiotics. And that's why we try to not give it if possible. And so we know theoretically it certainly increased THT response, which is the allergic response. And so really when the patient is got eczema, family history, plus antibiotics, they are much higher risk of developing true allergies. So what can we do about it? Probiotic supplementation is something we can do, especially if you're giving antibiotics. And so this study looked at antibiotics with probiotics given to cesarean section babies and found that definitely the bifidobacterium, the rhamnosus, have increased those levels of good bugs compared to bad bugs. The bifidobacterium went up, and therefore that may well decrease allergies long term. Now, a lot of babies get these reflux symptoms, vomiting baby, and a lot of doctors prescribe proton pump inhibitors. What does that do? I don't like it because it actually increases allergies. So what happens is that when we do blood tests on babies who have proton pump inhibitors, like Losec, the IgE, right, or the response to food allergens actually increase. There's an increase in 25% of allergy rate. So why is it so? What does it do? Number one, the pH of the gut, that's what proton pumpers do, stops pumping H plus or acid into the stomach. So when you have allergens, when you ingest it, like you never had peanuts before, you're having it, the body needs to digest it. But you can't because the pH is so high, like 7.4, there's no acid to break it down. If it's not broken down, then the peanut is a foreign body to that baby. And when it's foreign body, they say, well, I don't like this. I'm going to be sensitized to it. So that's why, even though it's been given regularly, I really like to stop it before they start introduction of solids, because that's when they're giving them lots of different food, like nuts, fish, egg, wheat, and they have a proton pump inhibitor because they had, as a baby, right, some reflux symptoms and gut problems, and they're drawing their legs up. All those things, yes, you can give it. It might help the symptoms, but long term, we know very well they become more allergic. And not only that, there are a lot more bad bugs because they grow much more. Bugs don't like acid environments, but probiotics do. And so probiotic actually goes down by having a alkaline or more neutral pH in the stomach. And probiotics love acid environments. So it both points, the fact that if the patient's on that, just because they like to get the child out of their surgery and get them something to do, I like to stop it if possible. And so the probiotic, the prebiotic together, and the effects of these prebiotic and probiotic on the microbiome and the short-chain fatty acid, which I'm going to talk about very soon, will regulate the immune system. We know we want a balance between the Treg cells and Th1 cells and decrease Th2. And so that combination effect of probiotic and prebiotic does that job. So prebiotics, we talk about HMO, which is human milk oligosaccharide. When you see the word oligosaccharide, it means a big molecule. That's why the word is so long. And so that oligosaccharide, it cannot be really digested and becomes a branch chain where the probiotics can grow. There are many other different types of probiotics, like wheat, banana, onion, garlic, leek, chicory. They all are actually good prebiotics. In the past, some other companies use FOS and GOS, which is fructose oligosaccharide, and galactose oligosaccharide, and they added to formula. But now with the invention of the fact that, why is breast milk so good compared to just formula? They found that human oligosaccharide, which is that complex carbohydrate in breast milk, and therefore they can now formulate and make it and add it to formula themselves. And part of this microbiome change is actually the post-biotic. Now, post-biotic means that it's actually the byproducts of the probiotics. That byproduct has major effects. So the microbiome changes, the probiotics, the good bugs, produces things like acetate, propionate, butyrate, and lactic acid, which helps the gut to grow better, to make the tight junctions better, to decrease allergy effect, and decrease sensitization. In fact, the Children's Hospital has actually done some work just on this and shows that the microbiome changes and the bifidobacterial rate goes up. And so this short-chain fatty acids is actually the active ingredients of probiotics. And basically what it does, right, these things that we can measure, and some studies have using these butyrates and help heal the gut and long-term decrease allergies. We know very well that there's a lot of children with cow's milk enteropathy, with blood in the poo, having a little bit of milk from mother's diet. And that little bit of milk can cause significant harm to the gut and causing blood. And that blood really needs to be repaired. Having probiotics helps this exact process, help those cells to grow back. And that's why in my patients with cow's milk enteropathy or even cow's milk intolerance will benefit from probiotics and prebiotics. So even in allergy itself, studies have shown that having the acetate and butyrate, which is the active ingredient of probiotics, the byproducts, will actually decrease the IgE level to peanuts and therefore decrease the onset of developing peanut allergy. So we now know, of course, breastfed babies have a much, much higher bifidobacterium in their poos. The bifidobacterium helps, we know that, because we know just analyzing poo of patients with allergies will have a different microbiome. And the patients with allergies will have a lower bifidobacterium count compared to those who don't have allergies. So that's part of the whole concept, why the evidence is there, that changing the microbiome may well change the rate of sensitization. Now, of course, not everybody can breastfeed, and thereby the formula-fed babies, which do have more Staph aureus and Streptococcus and Clostridium and more diarrhea. Now, formula companies are adding these good bugs, probiotics and prebiotics into it in order to help the microbiome and increase bifidobacterium rate. Now, formula companies have been doing the probiotics for a while, but unfortunately, based on the WHO code of making infant formula and making boiling water go down to 8 degrees will kill every probiotic in the formula. So it doesn't work. But luckily, the prebiotics in the formula will, because it doesn't get harmed by the high temperature. Mind you, we do really prefer you to make the formula at a slightly lower temperature. Boil the water up, of course, make it sterile, and bring the water down before you add the formula to it. Because the vitamins, the extra additives in there, and the probiotics will be dead. And so even though you say, oh, I've got the best formula, the gold formula with omega-3 and probiotics and all that stuff, well, unfortunately, if you follow the directions, the method of preparing the formula will basically knock those all off, unfortunately. So here comes the human milk oligosaccharide. Remember, oligosaccharide, big word, means that it's not digestible really, okay? And becomes the branch for probiotics to grow. And what they found is that the most common, most abundant form of oligosaccharide, which one is called 2FL and 2 big N, little n, and big T, okay? Lactose N-neotetriose. And those two are now made, but even patients with cow's milk allergy can have this as part of the fact that you haven't got breast milk. These two oligosaccharides are added now to formulas, or you can add it as a supplement. So we know that these two have been helpful to change the microbiome around, facilitate the lactate, butyrate, the postbiotic growth as well. So we know that those two are the most common, and that's why we add that to formulas now. However, there's also, of course, the question is, do we add these HMO to breastfed babies? Well, the answer is not simple. Most people won't because they, well, we are adding a similar amount of these oligosaccharides as breast milk. However, there is a big variation called the Lewis antigen system, which is part of the human blood group system, where some mothers excrete more oligosaccharides than others. And thereby, some are actually non-secretors. And so their HMO rate is actually quite low. In fact, some countries, I know in Malaysia, they have this machine that can actually measure the amount of prebiotics in their milk. And they measure and give that, because it's also time variable, because different times of the milk day, they can have a variable amount too. We know colostrum has more, but certainly high milk maybe have less. And even during the day, there might be variations. And what they do there, in fact, is interesting, is that they will give the preterm babies who's at risk of necrotizing enterocolitis and gut problems, the breast milk that has high oligosaccharides in, and not give the ones that have low, because there is a variation in timing. So it's quite interesting. We haven't got that system here, but certainly some countries actually have a machine for that purpose. So HMO, of course, is high in early stage of lactation, and it actually decreases over the next 3 months. And it's high in term, and preterm babies don't have as much. So colostrum has a lot of HMO. But look, at the end of the day, breast milk is breast milk. There is some in it. And so the question is, do we add to mothers? If you want to modify the microbiome, there's no harm in doing that. Okay, so this is the Lewis gene I was talking about. So some are what we call secretory genes, some are not, and so therefore there'll be a variation of that. And so secretory mothers, right, who actually have the one that secretes more HMO has less diarrhea, and they actually quite interestingly. So the patients, the babies born to these mothers have less diarrhea because their microbiome is different. And so by adding this, right, the microbiome has changed. And that's been shown in many, many studies itself. The fact that we are modifying it with extra HMO to especially babies with infant formula that are not breastfed, the HMO has benefit. So that immune modulation is what we're interested in. The fact that microbiome changes. And so all these things will help the overall effect of decreasing allergies. So this is some of the questions about different studies on this. Cesarean section babies with HMO would decrease the IgE levels. There's another one about infection. The fact that there's better bugs, you're going to have potentially less chance of gastroenteritis, even bronchiolitis in babies itself. We know very well there's many studies that if your child's going to childcare, if you have probiotics and potentially prebiotics, your chances of being absent from the school and getting all those bugs are much less. So there's many studies showing that probiotics given to babies going to childcare will be better, especially when they're starting off, and often they just be at home half the time. So HMO has been delayed in approving in Australia, but is now fully approved. I was on the FSAN's board to approve this, and I thought there was enough evidence that HMO is certainly potentially beneficial. And mind you, it has been approved around the world for a lot longer than in Australia. So, I mean, there are other formulas using phosphorus. I believe HMO is more like breast milk. And even studies on cow's milk allergy. Having HMO has actually decreased babies developing cow's milk protein allergy and intolerance. And that's been shown in the gut poos, and clinically that has been shown to some benefit. And so the last few minutes, we talk about the fact that the human milk oligosaccharides will actually benefit the overall, hopefully decreasing allergy rate, considering Australia has one of the highest rates in the world. There's another paper that's done at the Children's Hospital Westmead, looked at the incidence of calcium protein in 29 infants. Again, they look at the microbiome. They found that those with HMO, with the increasing of the butyrate and the lactic acid, the byproducts, the short-chain fatty acids, has similarly reduced the bad bugs like E. coli and increased the good bugs, and thereby potentially improving the microbiome more like a child that has no allergies. Another study again, there are many studies on this, on cow's milk allergy, which is so common. About 10% of babies have cow's milk allergies. And so having HMO, similar to breast milk instance, not that breast milk is 100% protective, certainly it can help as well. It can also help the probiotics because a lot of babies, if they can't have cow's milk for a long time because they have calcium intolerance, they help them to digest lactose when they start introducing it, because the breast milk is 80% lactose, and having the probiotics help them digest lactose as well. So really, in summary, in the last few minutes, we really need to think about how to decrease the incidence from 10% of the population. Now, interesting, our patients, there are so many more Asians born that have allergies now, born in Australia. If they're born overseas, often they don't have much allergies, which is very interesting. The breastfeeding is very encouraged, and most babies are breastfed in Australia. And those who are formulas, having a probiotic and prebiotic may well be good. So a lot of mothers ask me who already got a child with allergies, what can they do? They're pregnant. I said, well, based on the WHO guide is that if you're pregnant and you've got a family history of allergies, to give by third trimester, a broad spectrum mother and baby probiotic is useful, and that's been shown. And also after baby's born, when they're home, to give baby about 5 billion units of a Lactobacillus rhamnosus will also show to be decreasing allergies. And that's from that evidence is really based on my Cochrane review, which is overall allergy prevention strategy, and that's what's been adopted by the World Allergy Organization and WHO. And of course, we always think about make sure they have enough vitamin D, because low vitamin D is significantly associated with increased allergies. Many studies have shown that the babies who have children who have peanut allergies often find that they are born in winter because their vitamin D is lower. So what we recommend is exactly that, having probiotics from the third trimester, and also babies having probiotics and prebiotics and potentially HMO as well. Those who have cesarean sections and antibiotics are high risk, and those will be certainly ones that you should be recommending some microbiome changes. And definitely children with eczema. They are now a sitting duck. We know very well that any child with eczema, a skin prick test for all the nut allergens and wheat and egg and cow's milk is recommended by many allergy societies around the world. And of course, you've got a history of antibiotic usage during labor and afterwards for the baby who got sick for some reason, probiotics would be very useful. So take-home messages, they're the questions you need to ask. As dietitians, you should be an advocate for microbiome changes, because that often regulates the immune system, potentially decreases sensitization, and hopefully you've got a much healthier gut to digest, absorb all those nutrient things you want to recommend. So at our center, we're practically doing exactly that. Our 5 dietitians are really much looking at our patient-specific allergy modification program. We've actually desensitized them to all sorts of nuts, including peanuts, kiwi fruit, egg, avocado, seafood, lentils, peas, coconut. We've developed programs for all these different things. And part of the whole campaign from my dietitian is to ensure that they have a good microbiome. Because to desensitize, we want them to have good microbiome, because we know that the IgE level, right, overall will decrease. And so that is part of what we do practically. Not just talking about it, not just me writing papers on Cochrane Review and saying that probiotics are great and going forward for it, but actually that's what we do. In fact, many times of our counseling session with patients who come for our program to desensitize rather than avoid, and certainly we've got about 6,000 patients on our books to do this, we believe that the microbiome change is really crucial. Having good probiotic, a good something like HMO will help that process. And this is our 5 dietitians who's actually listening to us right now. And hopefully they learn something too. Thank you so much.